disclaimer, I'm going to be doing basic IV insertion, section 9 for Professor Lukowski. Hi Ms. Jones, I'm just going to go over the doctor's order with you for IV insertion for fluids and antibiotics and medications. First, can I have you confirm your name and date of birth? Okay, thank you. And do you have any allergies? Okay, perfect. We're going to be inserting a 20 gauge catheter and for fluid IV insertion site. If you needed blood products, we would use an 18 gauge. So first I'm going to go to your non-dominant hand. I'm going to be looking for any signs of AV fistula, and make sure there wasn't a mastectomy, or anything, no pain or tenderness in this area, to make sure it's not contradiction to the IV insertion. What we're looking for is a large vein that is bouncy and soft. We want to make sure that it's distal but not below a previous insertion site, and we want to make sure it's in the area that won't affect you with your everyday living activities. So we want to make sure it's in the non-dominant hand and not in the way of you doing other things. I'm going to prep over here. If you could just pump your arm, keep your arm low, and just pump your fist to get the blood flowing. And I'm going to just prep our materials over here that we need. First, I'm going to wash my hands, and then I'm going to don my gloves. After putting on my gloves, I need to get 3 milliliters of normal saline. So clean that off. And take out 3 milliliters of air. I'm going to insert the air. 3 milliliters.
Alright, so I'm just going to start rolling.
Then this would go in the sharps. I would not recap that. That's going in the sharps. I'm going to take my intense. Of course, for all my products, I make sure they weren't expired and check the packaging to make sure there wasn't any openings or anything that could contaminate them. I'm going to take off that. The end, I'm going to insert this. I'm going to flush a little bit of fluids in to make sure it's smooth flow in here.
Okay. So I would clean off my
And it is. Okay, so we're going to put that to the side. Now I'm going to prep the patient's skin. Now I want to put the tourniquet 4 to 6 inches above the site that I plan to do the insertion.
Using the ASASH method, I would ask.
I'm going to check the patient's pulse.
And then
I'm going to clean the area in a circular motion and let that dry. Once that's dried, I'm going to get the catheter, bevel up, and we want to insert at a 15-degree angle while holding the skin tight.
Okay, next I am ready.
And we're going to see return, flashback. So as I see that, I'm going to advance the catheter, apply pressure. This would go in the sharps, and I release the tourniquet. Now we're ready to apply this to the port. Okay. I'm going to aspirate. Okay, I see a flashback of blood. Great, so then I'm going to go ahead and advance. As I advance, I want to clamp this to keep a positive pressure and as gently as possible to do this. Okay. Okay. So we have the positive pressure there. I can disconnect this. Okay, so now I want to cover the area. And I would label it with the my initials, the date, the time, and the gauge site. And I would just tape this up here so it's out of the way. I would inform the patient to let me know if he sees any redness, feels any pain or warmth in that area, and document that I educated him that. In the chart, I would document the time, the location of where I put the IV in site, how the patient responded to it, the education I gave him, and the gauge and any difficulties that we may have and the number of temps that we took. Then I'll take care of the 4 P's to make sure there's no pain, position him, and pain, position, and personal items and potty. Okay? And that's how you do it.